and I'm going to quickly take through the lineup of the day. As usual, we're going to start with the Honorable Minister, Dr. Joe Phaahla, to give us the opening and welcome address together with the update as far as the rollout of COVID-19 vaccination program is concerned. It's going to be followed by a presentation on an update on epidemiological update from NICD. It's going to be delivered by either Dr. Michelle Groom or Dr. Wasila Yassat. It's going to be followed by going to get the state of readiness from the two provinces, the Western Cape by Dr. Keith Klute and KZN by Dr. Sandile Shabalala. Then we'll get a presentation on trauma by Professor Tim Hardcastle, who's the head of trauma and burns from Inkosi Albert Lutuli Central Hospital. Then we'll take the questions and answers, followed by the closing remarks by our Honorable Deputy Minister, Dr. Sibongiseni Dhlomo. Without wasting any time, I'm going to hand over to Honorable Minister, Dr. Joe Phaahla, to officially give us an opening address and the remarks. Over to you, Minister.
Thank you very much, Foster. Thank you. And good morning to my colleague, Deputy Minister, Dr. Sibongiseni Dhlomo, to our panelists from the NICD, Dr. Jassat and then Groom, Michelle Groom, our DG, Dr. Butelesi, and DDG, Dr. Nicholas Crisp, the two HODs who are going to update us on their readiness to handle the difficulties of the festive season, Western Cape, Dr. Keith Klute and Dr. Sipho Shabalala from KZN. And also let me welcome our trauma specialist, Professor Tim Hardcastle, from the head of trauma at Inkosi Albert Lutuli Hospital in KZN, who will give us a sense of the risks of trauma during this festive season. Good morning to all South Africans, viewers and listeners. This today, as we talk to you, is Friday the 17th, which comes a day after the 16th of December holiday, Reconciliation Day. Now, this period is traditionally, today on the 17th, is traditionally the last working day for many industries in South Africa as we head towards the Christmas and New Year festive period. This is the second festive season we go into in the middle of COVID-19 wave. Last December, we were in the second wave of this COVID-19. Last December, as we went into Christmas of 2020. We hope that today's briefing will provide all of us with the context of the extent of the challenges we face and how, as a government, we are trying to make sure that we can help those who will need medical assistance during the course of the festive season. But more especially, we hope this will also give us an opportunity to share ideas as to how we can work together in facing this pandemic, as at the same time, we want to have an enjoyable Christmas and New Year. Now, since we spoke to the nation last Friday, the fourth wave driven by the Omicron variant has continued to spread rapidly across the country, but also across the world. When we spoke to you last week, we mentioned that the variant had been detected by the World Health Organization in over 57 countries. And today, as we speak to you, the confirmation is that the variant has been detected in more than 76 countries. In our country, all 9 provinces are essentially in the fourth wave, even though technically the Northern Cape is still entering the fourth wave. But the rising numbers tell us that it's a matter of technical description. Otherwise, it's already already in this fourth wave with the Omicron variant. While Gauteng province is still reporting the highest number of new cases per day, the numbers have risen rapidly, especially in the coastal provinces, but all 9 provinces have seen a rise. And this is resulting in where, as of yesterday, for instance, Gauteng accounted for only 25% of new infections, Now, this is compared to around 7 to 10 days ago, where Gauteng was accounting for 70 to 80% of the new infections. The number of cases in the fourth wave have exceeded the peaks of the third, the second, and the first waves, with a weekly average new infections of more than 37 per 100,000 of population, while the peak of the third wave was at 33 per 100,000. So 37 already now in this fourth wave, when at the highest of the third wave, it was 33 per 100,000 of population. In the second wave, just a little below 32 per 100,000. And the first wave was even much lower in its peak at 21 per 100,000 of population in terms of new infections on an average weekly basis. The positivity rate has also risen steeply across the country, and with yesterday's average positivity rate of 31%. 8 provinces yesterday recorded a positivity rate of 30% or above, with only Gauteng, which used to hover around 35%, but it was the only province yesterday which was below 30% of positivity at 25%. In the last 7 days, new cases have increased by an average of 37%, with Eastern Cape, Free State, KZN, Western Cape, and Northern Cape having been showing more than 100% increase in daily new cases compared to 7 days earlier, which confirms a rapid increase nationwide. Active cases as of yesterday were standing just over 210,635, which is 10% higher than the last 24 hours. The good news is that the recovery rate is still very good, currently standing at 91%. In terms of hospitalization, as we have mentioned, at the end of the third wave, we were really rock bottom in terms of hospital admissions. Now, this has been now rising rapidly. Over the last 7 days, we have seen a 70% rise in hospital admissions, though in absolute numbers, as I've mentioned, it's a high percentage because we come from a low base. But in terms of absolute numbers, we're still at a fairly low level, just over 7,600 patients admitted as a result of COVID. Now, in comparison of the fourth wave, when you compare with the previous waves, the weekly average hospital admissions are definitely much lower than the weekly admissions in the third wave. And as we will see, during the first 2 weeks, when you compare the first 2 weeks of the fourth wave and the third wave. Now, in the second week of the third wave, which was between 17th and 24th of June 2021, there were an average infection rate of 4,400 new cases per day, but the admissions were over 800 hospitalizations per day, representing 19% hospitalization of COVID-19 cases. Currently, in the second week of the fourth wave, which we calculate up to just 2 days ago, from the 9th to the 15th of December, the average new cases per day were upwards of 20,000. Now, I said in the third wave, in the second week, the average was just over 4,000. In this wave, the average number of daily cases is upwards of 20,000. But hospital admissions are below 400, actually at 348, which is 1.7% of COVID cases being hospitalized, compared to 19% of the second week of the third wave. So although there is a rapid rise in hospitalization because we come from a very low base at the end of the third wave, the large majority of also these hospitalized patients are fairly mild. Case numbers and percentage testing positive are showing a decrease in Gauteng. Early indications are that we might have reached the peak in Gauteng. There is a corresponding rapid increase of cases in the other 8 provinces. The mildness of the disease may not necessarily mean that the virus itself is less virulent, but it's probably also due to significant vaccine coverage, especially as we see that over 60s, the over 60 of age, and that with that cohort of over 60s, we have already covered almost 2/3 of the population at 66%, and the over 50s at 61%. And the national adult average coverage, as we have reached over the last few days, at 44%. So we believe that it might not necessarily just be that Omicron is less virulent, but we believe that this coverage of immunization, of vaccination, but also in addition, natural immunity of people who have already had contact with the virus, it's also adding to the protection. That's why we're seeing mild illness. We are very worried about the drastic decline in the uptake of vaccination, especially in the last 7 to 10 days. There was an uptick immediately after the announcement of the new variant, but the numbers have gone down quite drastically. On the average, over the last few days, we have been seeing daily vaccinations during midweek of between 100,000 and 130,000, which is a far cry from the target which we need to reach 70%, which is over at least over 250,000 per day. So we are well over 100,000 short of the vaccine coverage for us to reach our population immunity and protect the nation. The COVID-19 virus is still very active, as we can see from the hospital admissions, the number of new infections. Just yesterday, we're again upwards of 26,000 new infections. So it's still very active, and we still have a long way to go before we can actually reduce its power. But it is within our reach to can reduce its power and also to can permanently defeat it and hopefully be back to normal life. The only major reliable weapon in going in this direction is if we can have more people coming forward to vaccinate. Over the next few days, many of us will be moving from places of work in the cities to our rural places and holiday destinations. We'll be celebrating Christmas and New Year with relatives and friends. We will be traveling for many hours in private cars, in taxis, in buses, trains, and aeroplanes. As we do so, we urge everyone to observe the known personal health and safety measures of wearing our masks properly, covering the nose and mouth whenever we are out of our homes, hand washing and sanitizing, physical or social distancing, and especially avoiding crowds, more so in enclosed settings, but above all, by making sure that we are fully vaccinated. A number of fixed vaccination sites will remain open in all provinces, and provinces also assured us that they will provide some pop-up sites again in the shopping malls and other congregated areas. We also call upon South Africans to celebrate this festive season with a lot of caution, especially with regard to alcohol consumption. Our health facilities are already under a lot of pressure with the COVID-19, as we indicated, a 70% rise in admissions, and we are least ready to handle large numbers of casualties from motor vehicle accidents and also interpersonal violence. Our healthcare workers are physically and emotionally exhausted, so we really plead on all of us to think of them as we celebrate this festive season. Again, let me, on behalf of the people of our country, express our gratitude to all our health workers who continue to sacrifice their own lives and those of their families, and also risking their lives while caring for all of us. Let us honor and protect them by, again, by making sure that we celebrate the festive season responsibly by vaccinating. The health department will advise the NCCC in the next few days as to whether we should review the restrictions, as we announced just yesterday that the last NCCC has decided to remain at where we are, but we have been tasked as a health department to continue to monitor the situation and report back in the coming week. If we all do our part, we can still enjoy a good festive season. It is in our hands, and there's an opportunity for us to make sure that we can have an enjoyable but very safe festive season. Above all precautions, as I've mentioned, we should get our jab before we go on jolling. So jab before you joll and jab before you jive. I wish you all a Merry Christmas and prosperous New Year. But as we go towards that in the next few days, we still have this obstacle to overcome the fourth wave. And we believe that working together, we can be able to go through this safely and enjoy our festive season. Thank you very much.
Thanks, Minister. And indeed, we need to prioritize the jab ahead of any other activities, as you've said. And it's our collective responsibility to ensure that we have a safer and a good and merry and prosperous New Year and Christmas. So on that note, I'm going to call upon Dr. Michelle Groom from NICD to give us an update as far as epidemiological report is concerned. Over to you, Doc.
Sure. Good morning, everyone, Honourable Minister, colleagues and all the viewers. Right, so I think we'll just give a brief update on where we are in South Africa, just to give the global kind of picture in terms of this really increasing number of cases globally that we're seeing, largely driven by increases in Europe. And as the Minister had mentioned, now 76 countries that have detected Omicron. But I think just to realize that many of these African countries here are not doing sequencing, so most likely it's more widespread even in those countries. So in terms of South Africa, we're seeing, as we know, this rapid increase in the number of daily reported laboratory confirmed cases, which has surpassed the peak of any of the previous waves that we've seen. And so for the last couple of days, really seen daily reported cases in excess of 20,000 and our 7-day moving average approaching 20,000. Just in terms of Omicron, for the sequences that we do have for November, the Omicron variant is dominating all of the sequences. We're still awaiting some sequencing from 1 or 2 of the provinces, but indications are that the increases in case numbers are being driven by this variant, and it has rapidly displaced Delta, as it is doing in many other countries. In terms of our provincial picture, with cases on the left, case numbers, absolute numbers, and incidents on the right. And so you can see Gauteng was the first province to enter this fourth wave with a very rapid increase, but quite optimistically that we're seeing decreases now in Gauteng over the last couple of days, but the other provinces really continuing to increase. In terms of the age distribution, I think also some concerns initially with those early increases in terms of the under 20s. You can see that there are still increases in those age groups, but they are much lower than the other age groups. And so we've seen this movement into the older age groups, and particularly the 20 to 39-year-olds and 40 to 59-year-olds. In terms of the percent positivity, which remember is the number of positives out of the total number of tests were done. And so you can really just see towards the end of November, very low positivity rates where we'd started seeing these increases in Gauteng. This quickly spread into the more northernmost provinces. And now you can see how this really has extended to all of South Africa. Just in terms of just the positivity rates per province, just plotting by time, and this is for the PCR tests only. And so really just to highlight, this is Gauteng in the blue, which it saw these early increases in positivity. We had this really rapid increase, which has leveled off. And now we are starting to see a decrease in the percent positivity. And this has proven to be quite a good metric in terms of predicting the end or when the province has reached a peak. But you can see in all of the other provinces, we are seeing increases. Northwest showing early signs of leveling off. And so hopefully they would also start reaching a peak in Northwest. Just in terms of hospitalizations, we are seeing increases in hospitalizations in both the public and private sector, but we are coming off this very, very low base compared to the interwave periods that we have seen previously. And just in terms of the number of deaths, also starting to see slight increase in deaths nationally. But once again, this level is very much lower even than the baseline period we were seeing between the second and third waves, and slightly more increases in the public versus the private sector. So just looking at each of the provinces, I think we really are seeing rapid increases, very similar to what we'd seen in Gauteng, in all of the other provinces, with Eastern Cape approaching the peak that they saw in the third wave. Dramatic increases here in Free State. KZN also surpassed the peak for their third wave. I think they had a relatively smaller third wave. Limpopo seen increases, Mpumalanga, Northwest, Western Cape, and Northern Cape. So I think seeing these very similar dramatic increases, quite different to the patterns that we were seeing with the third wave, where we had the provinces at very different time points seeing their third wave. At the moment now, all provinces seeing this increase. I just wanted to show a couple of slides on Gauteng. So just to show how the 7-day moving average has now started to decrease, and we would hope that this would continue in the coming days. I think also just to note in terms of the case numbers in blue, the hospitalizations in orange, and the deaths in gray. And so you can see with the third wave, as we saw the increases in case numbers here in the blue, we'd already started seeing increases in hospitalizations, and the increases in deaths followed very soon afterwards, and very much mirrored what was happening in the cases. And so what you can see now is we're talking about this decoupling of cases and admissions, in that we're seeing this rapid increase in the case numbers, but then the hospitalizations are not increasing as at such a dramatic rate, and we're really seeing very small increases in terms of the number of deaths. And this is really just the excess deaths from Gauteng, where with previous weeks, we've always seen this peak in the excess deaths, very much mirroring the peak in cases. And you can see very low numbers in terms of excess deaths in Gauteng for last week. So I think an increasing number of new daily cases and percent positivity in all of the provinces, except Gauteng, where we're starting to see some indications that they may have crossed the peak. Omicron variant dominates our sequencing for this month, making up even more of these genomes. We are seeing increases in hospitalizations in all of the provinces, but this early indication of decoupling of the cases and hospitalizations in Gauteng, which I think is some reason for some hope. Increases, we are starting to see some increases, but relatively small increases in deaths in most of the provinces, and really are just waiting in the coming weeks for more data on disease severity, both in adults and children, transmissibility and degree of immune escape. We are seeing some early studies coming out from our scientists, and we're also needing to do and wait for some results, some additional results on vaccine effectiveness and how this might manifold in terms of protection against infection and severe disease. And I think we have early indications that protection against the infection may be reduced, but we would still expect to see protection against severe disease. And I think, as the Minister has highlighted, really to continue with the public health measures that we know have worked in the past. I'm just going to hand over to Dr. Jasat, who will just give an indication, a presentation just briefly on the severity in Tshwane that we've seen, as this was the first district to really start seeing the cases, increasing cases. So I'll hand over to Dr. Jasat.
Thank you so much, and good morning to all the viewers. I will give you some data from DADCOV, the hospital surveillance for COVID-19, really looking at early insights in this fourth wave in South Africa. Just as a context, we know that this increase in the fourth wave driven by Omicron has surpassed nationally the previous waves, but we know that in South Africa, seroprevalence is likely to be higher than 70%, and we know that at least 40% of adults have received at least one dose vaccination, and that this increase has occurred in the midst of level 1 restrictions. So given that, this is some of the data across the country. In this graph, you will see the percentage of admissions that are treated with oxygen by public and private health sector. And where we saw increases during the peaks of the previous waves, in the last few weeks, we've seen a decrease in the proportion of people who needed to be on oxygen. And actually, it's been lower than it was, in comparison with any of the previous wave periods. And that's similar in the public and the private sector. Similar to the previous graph, this is the percentage of COVID admissions across the country who required ventilation. And again, you can see very low levels, lower than we've seen across the previous wave period in both the public and the private sector. This is a percentage of COVID-19 admissions treated in the critical care wards, which is ICU and high care. And there's been a sort of relative trend, a steady trend in both the public and the private sector. Although more patients in the private sector get access to critical care wards in the public sector, the trend has been relatively stable across each of the waves, except that in the last few weeks, a lower proportion of patients in both sectors have been admitted in critical care wards during their hospital stays. We calculate the percentage of patients who were severe nationally by month. And it's on average been around 66% with a little bit of increase at each wave period. However, in the last 2 months, November and December, you can see a lower proportion of admissions are severe. And for the first time, there are more non-severe patients than severe patients in hospital compared to the previous 3 waves. Also, case fatality ratio increases at the peaks of each wave in both the public and the private sector. However, in the last few weeks, it's declined and been lower than it had been before. Of course, it's early to look at severity and case fatality ratio data because we do know there is some lag between a patient being diagnosed and then having their final outcome. And so, of course, we require a few more weeks' data to really make pronouncements around severity and mortality. Just some data from Gauteng, as Dr. Groom has shown you, there does look to be some decoupling of the trends by cases, admissions, and deaths. This is a 7-day moving average in the current Omicron peak as a percentage of the Delta 3rd wave peak. And you can see that cases are peaking at around the same rate in Gauteng as the Delta wave, but admissions are peaking at a much lower rate, and deaths, while increasing slightly, have not increased to the levels of the previous wave. However, what's also important to note is that there was a very rapid week-on-week increase in cases, up to 500% a few weeks ago, although that trend has slowed in the last couple of weeks. We also at the same time saw a rapid increase in week-on-week change in admissions to hospital, although that was at a lower level. However, the concern of a very sharp rise in cases is that you have a sharp rise in hospitalizations that may overwhelm the health system. Just some data from the city of Tshwane Metro, particularly around the young admissions. We always saw children very mildly affected by COVID-19, and in terms of cases, only in the 3rd wave, we saw more cases amongst children. In terms of admissions, children made up around 5% of admission throughout the pandemic. However, in this 4th wave, children have made up over 20% of all admissions. On the graph on the right, you can see that between waves, children do comprise a higher proportion of admissions. And that trend was starting after the 3rd wave and continued into the start of the 4th wave. But while children made up over 25% of admissions in the early 4th wave, that trend has already started to decrease. And when you compare the proportion of admissions by age group, you can see particularly with the under 5, they made up 16% of admissions in week 46 a few weeks ago, and that decreased each week, and they now make up 7% of admissions in the most recent week, week 49. So there was a tendency towards more admissions amongst children, but that has shifted over the last few weeks with more admissions amongst older adults in the last couple of weeks. Just some data around severity. Reminder that we calculate severity in the hospital data as any patient who develops acute respiratory distress syndrome, who requires oxygen or ventilation or heart support, who is treated in ICU or high care or has died. There are some intrinsic biases when looking at severity data too early. Many patients are in the hospital testing positive incidentally. There's more capacity in the hospital, more beds available, so we're more likely to admit mild patients. And also we need some time to accumulate the outcomes data. Also, we use severe as a proxy for severity, the indicator that I've described. We don't have clinical and laboratory information in our surveillance system as a marker for severity. When you look at when you compare admissions in the early second wave, third wave, and fourth wave in Tshwane, one of the things you can see by age group is in the second and third wave, there were much more admissions in the older age groups, 40s, 50s, and 60s. However, in the fourth wave in gray, you can see most admissions have been in the under 40s. When you look at the length of stay in the 3-wave periods, you can see in the second and third wave, length of stay was on average 8, 9, or 10 days, depending on the age group. However, in the fourth wave, you can see the length of stay for every age group is lower, around 3 or 4 days for young adults and children, and around 4 or 5 days for older adults. When you look at the percentage of admissions that were severe, you see that in the second and third wave, there was increasing severity with age, with the oldest group, 60, 70, and 80, having almost 80% severity. However, in the fourth wave in gray, you can see severity is lower in every age group, particularly amongst adults. And amongst children and those aged 20 to 29, severity is on par with what it was in the previous wave and lower than what it was in the second wave. You see in the second and third wave, case fatality ratio increased with age, and it was highest amongst the oldest groups at about 50% of those over 80 who died in hospital. However, in the fourth wave in gray, you can see mortality has been lower in every age group. Anecdotal reports from Gauteng is that testing practices have not changed, but many of the admissions are incidental positives. Most of the admissions are mild and of a short duration. Most admissions are in unvaccinated people. And in terms of the pediatric admissions, most are non-respiratory presentations. And with the adults, many of them do not have lung involvement requiring oxygen and ventilation. In terms of general practice, there's less patients who need to be referred for home oxygen where there are such programs available, and less patients being referred to hospitals. In summary, in terms of the provincial trends, Dr. Groom has shown the wave in Gauteng seems that it may be peaking. However, other provinces are still rising quite steeply. And I think what's important is that the force of increase in cases means that even if there's lower proportion of cases admitted, there's still a very high rise in hospitalizations. And in terms of preparing our hospitals, we need to ensure that we have sufficient capacity. But also countering that is that patients do seem to stay for a shorter duration, which means the turnaround time on a bed may be quicker. But again, to bear in mind that during the waves, we see more infections of healthcare workers and they need to isolate and quarantine. So that also produces a strain on hospital capacity. The trend in increased admissions in children seems to be shifting, but children did make up a large proportion of admissions in the fourth wave. And in terms of severity, there does look to be a lower rate of hospital admissions and deaths amongst people admitted in the fourth wave. There are signals towards less severity in adults with less requirement of oxygen, ventilation, and being treated in critical care. However, we want to watch the data over the next couple of weeks to be able to make better pronouncements on severity. And another marker of severity is there is a shorter length of hospital stay in the fourth wave compared to previous waves. It's very difficult to disentangle if the picture we're seeing of less severity is due to the fact that we have a lot of prior immunity, either from vaccine or natural infection in Gauteng, or is it the intrinsic virulence of Omicron? But what we do know is most admissions are in unvaccinated individuals. There is a lot of seroprevalence, probably over 70%, and at least 40% have received 1 dose of vaccination. But studies have shown that you have a higher risk of reinfection with Omicron, and that there is some vaccine escape for infection, but that the vaccines are likely to protect you against severe disease and hospitalization. So just a final note in terms of response, I think it's important to note, even though there are signals towards less severe admissions in the fourth wave, there is still always a spectrum of disease, and people can be admitted to hospital. Some people may have mild disease, some may be admitted to hospital, some may have severe disease and die. And so then it's not that every person will have a less severe disease in this fourth wave associated with Omicron. I think the other thing to note is while we're looking at trends in Gauteng, other provinces may have a different picture because they may have lower seroprevalence and a lower vaccination rate. So we'll be watching to see whether the same trend that we see in Gauteng holds in other provinces as well. And then also important to note that there are some pockets of vulnerable people in the communities. Those that are unvaccinated, those that have not had previous infection with coronavirus, I think are at risk. So the recommendations are still for all people to observe mask wearing, avoid gatherings during this wave, and to vaccinate if you haven't been vaccinated. Thank you so much.
Thanks very much, Dr. Wasila Yassat and Dr. Michelle Groom for that update as far as epidemiology is concerned. In political circles, they normally say a day, not a week. It's a long time in politics. So we should not enjoy a honeymoon before the actual marriage. So the way we conduct ourselves between now and Christmas is the way the NCCC will be able to make the next move. So on that note, I'm going to call upon Dr. Keith Kloot, who's the HOD of Department of Health in the Western Cape, to tell us the state of readiness as far as the province is concerned. Over to you, Doc.
Thank you very much, Foster. Thank you, Minister, and thank you for everyone else. Foster, you can see the slides?
Yes, it's visible.
Thank you very much. So I'm going to give a very rapid update of the situation in the Western Cape, a little bit on the surveillance update, then our fourth wave preparedness and our vaccine update with a few key messages. What we've been doing in the Western Cape ever since the start is doing our overlay of all our key markers. And it's very important to just point out the following to you, very much in line of what you've just seen from Dr. Groom and Dr. Issip, is that the black line is the increase in active cases. You can see a rapid rise to the right-hand side, followed by smear positivity, which is yellow. But you see hospitalizations are increasing, but at a much slower rate. You'll see green is the oxygen use. Oxygen use has not actually started increasing yet in the Western Cape, and red is flatlining for deaths. So that's very much the picture that is emerging in the Western Cape. This is our steep increases week on week. It's about 3,000 new diagnoses per day for the 7-day moving average. We have now gone over smear positivity of 40%. Our admissions are showing an increase, but it's only 65 per day, and the deaths are still less than 1 death a day. This is the picture just to illustrate to everyone. And we can tell you now that the gap is widening, but our gap started widening in the third wave already. And at the time, we looked at all our data, and that gap between hospitalization and cases was because of the early impact of vaccination already in the third wave. What we're seeing now is a much wider gap between hospitalization and cases. So what does it mean for our readiness? We got a six-point plan. The first one is to change community behavior. That is still the protective behaviors. We follow the signs, and it's really just about immunize, wear a mask, ventilate, and go outdoors. The second point of our plan is ongoing surveillance. We have a very proud history of all our data and tracking. You'll see some of that in this presentation, and we continue to track now not only hospitalization, but actually hospitalization for severe infection, and that is oxygen use and deaths that comes with it. And then supporting the mass vaccination program to make sure that we continue to drive vaccination. And then the fourth point is to titrate our health platform response, and I'll explain a little bit of that. It's bringing capacity online as required, as we've done in the previous waves. Then maintaining some form of comprehensive service through all of this, and then looking after the healthcare workers. And just on the healthcare workers, I think the point was made that we might have more, because we have more infections, more healthcare workers are infected, and therefore more healthcare workers are in quarantine and isolating themselves, putting additional strain on the healthcare system. So this is our triggered response. So we have 4 levels of warning. You'll see that our trigger in the first level of warning is actually an increase in oxygen use. Then the second warning is a 10% increase week on week, 7-day average for admissions. We have realized that there's a difference between admissions now and oxygen use. So we are going to make that 7-day moving average for severe infections, because that gives you a much bigger indication of the pressure on the healthcare system. And so it goes on. So we've refined this to the second and third wave. This is the way that we trigger our response for the fourth wave. And what does that mean? In each of these kind of triggers, we bring additional acute hospital capacity online. So we bring more than 30% than what we had before. We bring critical care capacity online, intermediate care capacity online. So that's our field hospitals. We also start shifting referral pathways if need be, if there's a place under pressure compared to another one. We've also looked at our ambulance services, and we contract private EMS in as needed. And then very importantly, we work with AFROX to make sure that we have oxygen. So just assure everybody, we have sufficient capacity, oxygen, staff to be able to cope with the third wave peak, if more, and it at this point in time does not look like our hospitalizations will approximate the third wave peak. We also have a daily dashboard of telling us exactly where we are in terms of each hospital in the province is on this dashboard. You can see the 9% of all patients in acute hospitals currently in the Western Cape is COVID. So that is confirmed COVID with PUIs. But very importantly, the designated capacity to the right-hand side of critical care beds is only at 15%. Comparatively, at this point in the other stages, we were already hitting about 50-60% critical care capacity at this stage. So this is our hospitalization update. So we are seeing a sustained week-on-week increase more than 20%, but the current hospitalizations are COVID-related, but like in Gauteng, many of those hospitalizations are incidental. So people admitted for other purposes in hospital, because everybody that gets admitted gets a test. You can find people that's positive. So because of that, that has diluted the percentage of severe people presenting with respiratory signs for COVID. This is our heat map, and this tells a story similar to what you saw in Gauteng. And if you look at the peak of the third wave, which is week 31, 32, 33 for us, you'll see a heat map between the ages of 46 till about 65, 70. If you look now, and last week is a full week where we've gone from 161 admissions to 665 admissions. The week to the right is this week, and it's only got 2 days data. By the end of this week, we're updated, and we expect that to be about 900 admissions. But the pattern that we're seeing is lower age group, similar to what you just saw from Gauteng, from Tshwane data. And there's probably two things that we're saying out of that, and that is probably people are more exposed in this age group, but also have lower vaccine protection in this group. We also track trauma. I know there's a presentation from Professor Hardcastle on this, but what we've been doing is at 20 trauma units we're tracking, and we can see the month-end increase in trauma. We're expecting that towards the end of this month, and we see the weekend increases. And it's just to remind everybody, at this point in time, this results in more than 2,000 admissions, more than 110 deaths, which puts an additional strain on hospitals while you're increasing for other capacity. So our vaccine update, just to make the point that we're doing here, in our 60 plus in the Western Cape, we have fully vaccinated currently at 66.3%. I'm currently in a place called Overberg. Over 60 plus, they have 76% over 60, they have over 85% coverage in the Overberg. So that 66 varies from one district to the other. And in 50 to 59, we had 57%. Overall, almost 62% of everyone over the age of 50 in the Western Cape is fully vaccinated. So in conclusion, we are in the fourth wave in the Western Cape, rapidly increasing cases, driven by Omicron. We obviously urge everybody to vaccinate, wear a mask, avoid enclosed spaces, gather outdoors to contain the spread. The early evidence of Omicron is emerging, indicating a slower uptake in hospitalization and death. We have to await the robust research, as the NICD colleagues have said, to avoid premature conclusions. We have sufficient capacity. We've activated it in a stepwise way. We trigger it, and we will mitigate the impact of the fourth wave. Our biggest weapon remains vaccination, and we continue to motivate everyone to get it. Thank you very much.
Thanks very much, Dr. Keith Klute, for that presentation on the state of readiness as far as the province of the Western Cape is concerned. Without wasting any time, I'm going to call Dr. Sandile Shabalala, who's the head of department from the Department of Health in KwaZulu-Natal. Over to you, Doc. Dr. Shabalala.
Yes, good morning, Foster. Good morning to the Minister. Good morning to the Deputy Minister, the DG, and the colleagues in the meeting. May I check if my presentation is visible to yourselves?
Yes, just put it on as, oh yes, sorry, yeah, you can go on now.
Thanks, I'm going to be short. Thanks, Foster. Foster, we have the numbers that are showing as a province of KwaZulu-Natal in terms of the COVID cases. We are registering 33,748 cases that are active currently. And of those, only 1,546 are admitted, both in the public and the private sector. I think I will look at that. Minister did allude to the fact that recoveries are doing well. We have seen a decrease in terms of these recoveries compared to the active cases. I think the number of new cases that are coming in has increased drastically, hence the decrease in terms of the recoveries that we are registering. In terms of deaths, we are still sitting around 2.83% as a province of KwaZulu-Natal. My slides seem not to be wanting to move. Oh, okay, thank you. The assertion that we have surpassed our third wave in terms of numbers is true. If you look at this graph, you can see that, in fact, our 7-day moving average has increased drastically, including also our median, which is now sitting at 2,757. That's a great increase if you compare us from the last week of November to now on the 17th. So we are still seeing these increases in terms of 7-day average and the daily cases that we are recording, which is a worrying factor. But if we will then look at the comparison again, we've seen an increase between week 49 and week 50. We've seen, Minister, a recorded 100% increase. When we calculated, we looked at just the 2 weeks and we found that we were having 77% plus increases, which also is worrying in terms of the new cases. But that also speaks to the incidence risk, which has increased. If you think that the incidence risk is supposed to be less than 5, there is no region or district in our province that has a single-digit incidence risk. So our view is that while we may be having areas that you would want to call hotspots, we need to be vigilant in all the districts of our province in terms of our case finding, contact tracing, and all the relevant work that we have to do in terms of COVID-19. The admissions, we've seen them increase as well, both in the private and public sector. From the 1st of December to the 15th, we've seen admissions rising from 79 to 971 on the 15th, which is a big increase. Although we must say that in terms of available beds, we're still comfortable, but these increases coupled with the increases that are informed by trauma, violence, and the accidents, if it goes up, it will give us problems. Again, we're seeing these changes just before the start of the official holidays, if I may call it that. This is just before the 16th of December. So we're worried about that. What is going to happen between the 16th of December and at least the 6th of January? We will continue to monitor that, particularly in terms of the trauma and also the COVID-19 cases. Again, the hospitalizations and the ICU admissions, we've seen them increase in these days. But I think it's important for us to mention that the increases are seen mostly in the private sector, but we've seen increases in terms of ICU admissions in our ICUs as well. Again, we must mention that these increases will have more people being admitted for COVID. Those that are admitted are mostly the unvaccinated people. So the people that are vaccinated may need admission, but hardly do they need to be admitted in ICU or high care. And the prognosis seems to be better with vaccinated people. This is the bed status in our province. All we are reporting to the meeting is that of the 21,453 available beds or operational beds in the province, in the public sector that is, 5,089 are available for COVID-19. Not all of them are occupied. I think the this slide then shows the occupation of these slides. You may remember that I said the admissions currently in the public sector are sitting at 971, which is 29% occupancy of all the COVID-19 beds. So we're still relatively comfortable in terms of preparedness, in terms of admissions. This is not only in terms of the beds themselves, but also the human resources. What we should mention, however, is that we're worried about the fact that even our healthcare workers do get to be infected. And each time a healthcare worker is infected, we then look at the contacts, and that destabilizes not only the COVID wards, but all the other operations. If a healthcare worker in theater gets to be infected, the team working with that healthcare worker also needs to be checked, quarantined, and all that. That then disturbs that theater functionality or whichever other ward. So those are issues that are worrying us. It has not been as severe because most of our healthcare workers are vaccinated. And I must say that we still are worried about the fact that in terms of the second dose of J&J, our healthcare workers, we still are sitting with more than 15,000 of them not coming back to be vaccinated for the second dose. So we're worried about that aspect. So that is how the outlook currently in terms of our occupational beds and in terms of our operational beds and the occupancy thereof. The facility readiness, we must say, when we looked at ourselves preparing for both the fourth wave and just the holidays, we
Dr. Shabalala, we can't hear you. Doc? We have lost Dr. Shabalala. Hi, Doc?
I think we should move. I think we should move first. I think we've got the gist.
Yes, yeah. Okay, thanks, Minister. On that note, I'm going to call upon our next presenter, who's Professor Tim Hardcastle, who's the head of trauma and burns at the University of, not university, at the Inkosi Albert Lutuli Central Hospital. Dr. Shabalala will have to make the inputs during the questions and answers as we move on. Without wasting any time, I'm going to hand over to Prof. Tim Hardcastle. Over to you, Prof.
Good morning, everybody. Good morning, Mr. Minister and members of the press. So the brief that I've been given is to give some perspective on trauma and what trauma is and what we're expecting for the festive season. So first and foremost, what do we mean when we talk about trauma? It's not the medical emergencies, it's all the other stuff, the gunshots, the stab wounds, the falls from a height, the car crashes, and obviously the car crashes being the real concern because there's traveling on our long distance roads, there's people on leave, the roads are congested, and that certainly increases. But we also know that alcohol consumption increases over the festive period. People want to celebrate. Unfortunately, they do a little bit too excessively, and that leads to violence and so on. And again, we've got to keep in mind, we've just ended the 16 days against violence against women and children, and unfortunately, women and children are also affected by trauma significantly. So what are we largely looking at? Well, we're looking at crashes. I think it's very important to get away from this concept of calling what happens out on our roads an accident, because the term accident implies that it can't be prevented. And most of these crashes can be prevented. And the important aspect with a crash is that it's not just a case of two cars getting damaged and a few people needing to go to an emergency department. It is a multi-system, multidisciplinary team effect that is required, from the EMS to the emergency transport services to the emergency department where the patient is assessed, resuscitated, and then either admitted to a general ward or an ICU or possibly needing emergency surgery. And there are huge numbers of healthcare workers who at this stage are very tired and worn out from being overburdened with the COVID, and now they're facing their annual onslaught. Now, we need to understand that over the years, the trauma numbers and the road fatalities have varied significantly. We dropped down to a low in about 2013, and it has steadily increased over the past few years again. We know that there's a December, January peak every year, and then there's usually another peak around March with the Easter holidays. The challenge we have in this country is we have no national trauma registry. And as such, accurate data on non-fatal trauma is very much dependent on individual facilities. There's a number of the big trauma centers in the teaching hospitals and one of the private healthcare groups that has a registry of sorts, but there's no national registry. And that's certainly something that we need to look at implementing, like the Western Cape is doing, to see where we're going with trauma. KZN records some of their data on the DHIS, but it's something we need to look at. So having said that, we're also dealing with COVID. What has COVID done to trauma? Well, we know that, and this is just excerpts from two of the publications during the course of the last 2 or 3 years. There's around 15 publications that have come out from the trauma services around the country. And what we do know is that during the lockdowns, the trauma dropped off. You can see the dramatic drops in the totals, less drops in the penetrating trauma, the gunshots and the stab wounds. And certainly we think people were getting irritable with each other at home during the lockdowns because the blunt force trauma seemed to have gone up, but the motor vehicle crashes certainly came down. Looking a little bit further back at what we are dealing with, and this is work that we did with the DHIS here in KZN a few years back, and this is an ongoing evaluation. We're probably going to publish the 10-year data in the next year or so. But what you'll notice is that the preventable trauma, which I include gunshots, stab wounds, and the crashes, makes up easily 60 to 70% of what we deal with. So that can be reduced by simple prevention. Our motor vehicle crash rates, huge numbers every year in KZN, and you'll notice that the vast majority of these are first presenting to our district hospitals. And our district hospitals are under strain. Most of our long distance roads have small district hospitals. They might only have 1 or 2 doctors on shift, and so therefore there's delays to care. Even the private sector has limited facilities along the national highways for the simple reason that these are largely rural areas. And this certainly impacts on the mortalities that we're seeing. Looking at what comes to us in KZN, the vast majority of the motor vehicle crashes made up with pedestrians, and again, drunk pedestrians on highways where they shouldn't be in the first place, contribute a significant portion of the trauma that we see. And unfortunately, while children should be seen and not hurt, children get involved as well. And you'll notice from that big circle, the vast majority of pediatric trauma is pedestrians, with the blue arrows indicating the passenger. So it's not drivers that are being injured when it's children, it's the pedestrians out on the roads being knocked because either they're not seen, they're not aware of what is around them when they're crossing the road, or because the drivers are not paying attention. So what does this cost us in rands? So I just happened to have yesterday looked at the eThekwini road traffic report, and they make the point in that report that just for the city of eThekwini, 11 billion rand per year has been spent on road crashes in the city limits. In our unit, we looked in 2017 and 2018 at the cost per patient for ICU care for motor vehicle crashes. And we worked out that it was 164,000 per admission. Now, we only have 10 ICU beds for trauma in the province of KwaZulu-Natal. The other hospitals have general ICU beds. That works out at 22 million rand a year. That is potentially preventable financial loss. So what are the options? The options are to comply, to practice prevention, teach the kids to wear reflective clothing if they're out at night. If they're on their bicycles, give them a bicycle helmet. If they're in the car with you, and I realize it's difficult in taxis and buses, but if they're in the car with you, seat belts, baby chairs, you know, these prevent death, and they certainly prevent injury as well. And then for yourself as the adults, don't drink and drive. Make sure you've rested adequately. People falling asleep at the wheel are a well-known concern. And we see a lot of the truck accidents along our highways as a result of drivers falling asleep at night, where they're expected to take the load from Gauteng down to the harbor in one go with no real rest. And of course, mechanical issues. It's one thing to break down and have a flat tire, but then make sure that your indicators are working so you can put your hazards on and protect yourself from getting taken out by the vehicle that's coming along behind you on the highway. So with that closure, just to say a thanks to all our emergency services and the actions that we take to prevent trauma. We're out there for you. What we need to develop in this country to make this work better is proper trauma systems. And the way to do that is through trauma registries. But when all is said and done, remember that prevention is far better than cure. So if you can avoid becoming a trauma statistic in the first place, it makes my life easier, but it also makes your life longer. Thank you very much.
Thanks very much, Prof. Castle, for that presentation as far as trauma is concerned. Indeed, we need to look after ourselves, don't drink and drive, but vaccinate. On that note, I'm going to open the question and answer session by first taking the first batch of questions. We've got about 20 questions that I'm going to take the first batch of questions, about 10 questions, then get responses, then take the last one. On that note, I'm going to start with the first question, which is coming from Miriam Issa from Business Intelligence. Read as follows. Why did you not reduce, this one is directed to the minister and the colleagues, why did you not reduce the permitted size of large gatherings over festive seasons? Hundreds of people seem a bit excessive and usually increase the risk of infections. Number two, is there any consideration to reduce the length of isolation for close contacts as per the advice of some health professionals, given apparent mildness of Omicron variant? The third question from Sumen Naidu, a freelance journalist, he says, is the minister able to provide an update on the president's recovery to South Africans? We know that the president has tested positive and has been in isolation. So they want to know if the minister has ever interacted with the president and how is the president doing? The fourth question is, can minister explain why the decision to stay on alert level 1 was not announced either by president or deputy as the culture? Question number 5, is the Pfizer booster going to be rolled out only to those who are 18 years and older, or will this include those who are 12 years and above to get the booster shot of Pfizer? Another question is, what is the latest update regarding the vaccine booster program? This one is related to the one that the question number 5. Question number 7, how and when will the boosters, both J and J, be rolled out to the general population beyond Sisonke? Number 8, will this be rolled out according to the age groups like the initial rollout, where we started with the older ones up to the younger generation? So will this be, the booster shot be rolled out according to the age groups and those who are living with comorbidities? Question number 9, what are the time frames between the first and the second doses of booster jabs? Is the department advising how long will people need to wait before they get their boosters? The last question of the first batch, what is SAPRA or department's view on mixing mixing or matching vaccines doses as boosters. I'm going to stop here and allow Minister, Deputy Minister, and members of the panel to respond to this. Over to you, Minister, and members of the panel.
Thank you very much, Foster. I'll take a few. I think dominant of the questions is about vaccines and boosters. Just on the first question, why were gatherings not reviewed? The NCCC felt that we needed to study the situation further, looking at of course, the rapid rise in infection rates, but balancing that with the fact that few people were actually in proportion needing hospital admission, and also some of the information which has been given by colleagues about the fact that even amongst those who are hospitalized, large number of incidental COVID having been admitted for other purposes, and also less of the people needing high care and including just needing oxygen. So with all those factors, but largely also that as of last week, the major experience was only from Gauteng. The view was that we needed to come back with a bit more information, especially in terms of the pattern as the pandemic is, the fourth wave is spreading into the other 8 provinces. So we are expected to get back in the coming week, back to the NCCC to provide further information so that decisions in relation to how we approach the festive season can be taken. So that was the approach that we should come back. Well, on the president, I'm not, as it's been mentioned, the president is under the care of the South African military health services. So I'm aware that it is of public interest to know how the president is doing. So we will communicate with the presidency and seek their advice. We'll pass this message so that from their side, because we really are not, don't have access and authority, is the military health services and the presidency. So we will indicate this desire of South Africans to have a sense of how the head of state is doing. The reason why the decision of the NCCC was not announced by the deputy president or president, as you know, well, as is usually done, the main motivation was that because it was not a change in terms of the level and the status, no new restrictions or amendments were decided. The decision was to keep the status quo. The view of the presidency was that the health department, health ministry should handle this because we are not announcing any changes in terms of the restriction status. So if after the next briefing there are changes, then the presidency will take responsibility to communicate those changes. Foster, I think the rest of the issues are really about vaccination. The review on isolation of contacts, Dr. Buthelezi and Dr. Crisp can deal with that, and then the vaccination side, I think largely, I would think Dr. Crisp and anybody else he can allocate should be able to deal with those. Can I therefore invite DG and the DDG, Crisp and Buthelezi, to quickly respond? I think there's a composite number of questions on the vaccination and boosters, but one of them can deal with the review on isolation periods. DG?
Thank you very much, Minister, and good morning to the colleagues and the viewers and Deputy Minister as well. Yeah, I will deal with the one on the isolation. The work is very advanced and we should be getting an advisory soon from our Ministerial Advisory Committee to guide us on this matter. As the panelists and the media can if you can recall that when we're dealing with, when we actually cut the isolation period from 14 days to 10 days, there was quite a lot of work and we needed to be guided also by the WHO. So we would like to promise our media and colleagues that we're expecting in the next day or two that we'll get an advisory from the Ministerial Advisory Committee, which we will then, through the minister, communicate and then get out a circular accordingly. I'd like to request my colleague, Dr. Chris, to deal with all the vaccination-related questions. Thank you very much.
Good morning, Minister, Deputy Minister, colleagues, and the media. Thank you very much. So I'll just recap one at a time that the Pfizer vaccine boosters are already approved by SAHPRA, and there have been discussions in the Ministerial Advisory Committee. The interval that has been approved is 6 months, which means that we will start to vaccinate anybody who had a second dose of Pfizer 6 months after that second dose, and that starts on the 28th of December. So we are hoping that we will be ready either then or within days after that with the vaccination. So that will apply to anybody over the age of 12. But clearly, we've only recently started vaccinating children or adolescents between the age of 12 and 18, so it'll be a long time before we get to those boosters. There is discussion around whether to shorten the period from 6 months, and if that is decided, then we will announce that in due course. As far as the rollout of the boosters, today is, for Johnson & Johnson, today is the last day of the Sisonke study, for the Sisonke 2, which is the vaccination of the booster doses for healthcare workers. And we are anticipating either today or over the weekend a recommendation from, or an approval from SAHPRA on what is to happen with the remainder of the population who were vaccinated with Johnson & Johnson. Those evaluations of various of the study results, as well as various other inputs from Johnson & Johnson, have been going on during the course of this week. So we know that it is well in hand, and we should make that announcement in the coming days. As far as the age group rollout, well, now that's a bit of a moot point because the rollout follows a particular interval from previous vaccinations. So yeah, I guess that it does mean that we do follow an age rollout, but it's not specifically following the age rollout, it's following the interval. So if people who are younger came at the start of their age rollout and others who are older came only after their a subsequent age group had started, it will be the gap between their doses that matters and not the age that matters. I hope that's clearer. The interval between first and second doses, at this stage, what is approved is 6 months. As I said, there has been some discussion around Pfizer intervals being reduced. We know that some countries have gone to 3 months, but those are countries where the number of primary vaccinations is far in excess of what we are experiencing. So we are not in that position at the moment, and we will wait and see whether there's good reason to reduce it to either 4 or to 3 months in the months ahead. As far as the Johnson & Johnson is concerned, the initial indications is that it will be a 2-month interval between the single dose that has been given and the booster dose. As far as the mixing and matching of boosters is concerned, we don't have any formal decision on mixing and matching at this point. There have been a number of documents submitted. SAHPRA will be giving us guidance. There was a WHO SAGE report released earlier this week, which is being submitted to the Vaccine Ministerial Advisory Committee, amongst other documents. And I'm sure that in the coming meetings of the Vaccine Ministerial Advisory Committee and the outcomes of the discussions and decisions of SAHPRA, we will get guidance in the weeks ahead. Thank you very much, Minister and DG.
Foster, I think they are done. I think Dr. Crisp handled the whole composite of questions, which all related to vaccination. I hope that it has covered all the issues. Unless if there's something which has been left out, you could maybe just help us to check if there's a question which has not been answered.
Yeah, I think all have been answered. Let me read out the last batch of questions. There are very few. I know others are repeating themselves. Without wasting any time, I'm looking at the time. This first question of the second batch is from David Mackenzie from CNN. It's directed to Dr. Wasila. Proportions of severity patients on oxygen and ventilated have gone down as cases have gone up related Omicron. Does this give some early evidence that the variant is less virulent? What percentage of hospital admissions are unvaccinated? I saw Dr. Chris tried to respond to this on the chat, but we can respond publicly for the benefit of those who are not able to read the chat responses. How long will it take for a person who has recently tested positive to vaccinate? Laura Lopez Gonzalez is saying, what vaccination rates are we seeing in rural district, and what is the most popular kind of vaccination site there? Secondly, how will the department react to the CDC's decision to recommend other vaccines over J&J following more blood clot data? Another question, when will we be able to see definite stats of hospitalization or severity in respect to proportion of patients vaccinated or not vaccinated? The last two questions, somebody is asking if he or she is correct that previous infections appear to provide more protections than vaccination. What is the cause of death in the fourth wave, especially specifically Omicron infection? The last question, considering the positive data just presented on hospital admissions and case severity, are stricter lockdown measures being considered? I know Minister has touched on this one, but you can still feel free to elaborate on it. So this is the last question of the second batch. Minister and members of the panel, over to you.
Well, maybe I can just deal with the last one. As you said, the question of whether stricter lockdowns, the information which we are sharing with the public currently gets regularly updated. Possibly we might have another session of the Coronavirus Council on next week, Monday or Tuesday, possibly on Tuesday. We will then provide an update in terms of the patterns of what what we are seeing, the pressure on the hospitals, the rise in numbers, the effects in terms of society and behavior, the risks in terms of the safety. All those factors will then be compiled and recommendations given to the NCCC, and it will be up to the committee and what recommendations to make to cabinet for final decision. So really that's how we're going to go about it. But I want to again emphasize that rather than depend on what restrictions, we again appeal that if we can work together, take personal and group and community safety measures and family safety, look after each other, workplaces, whenever we get together, make sure that we observe all the protocols, whether we go out shopping and other activities, there will be less need for government to impose particular restrictions. But in terms of where, as a public health measure, some changes need to be made, that will be considered early in the coming week. I think the rest of the other questions, the team from the department and also from the NICD will be better placed to can respond to. Let me get back to DG just to see how, I think some of them were directly asked to the NICD team. I know the first one, 11, 12, and 13. Maybe we should start there, DG, and then you can look at the rest. Thank you, Foster. Can we start with Dr. Joseph? I think there was a direct DG. Yeah.
Yes. It's Dr. Jasat, just to deal with all the other questions. Thank you very much, Minister.
Thank you so much for those questions. So with regards to the question that is the lower severity picture we're seeing an indication that Omicron is inherently less virulent? I think it's difficult to say that given the data we're presenting, because we are comparing the picture in the fourth wave compared to the second and third wave and using the wave period as almost as a proxy for the variant. We're not specifically looking at people with Omicron compared to those with Delta or other variants. And so things have changed between the second, third, and now the fourth wave in terms of more vaccination coverage and higher seroprevalence accumulating in South Africa. And so we are cautious to say that the lower severity picture we're seeing right now could be as a result of, very high seroprevalence and natural, immunity from natural infection and some immunity from vaccination. And I think we need more studies to really understand comparing Omicron with Delta particularly to see whether it is more or less virulent. I think that we have to interpret the less severity data in light of the high seroprevalence and some vaccination coverage. With regard to the question around whether previous infection is more protective than vaccination, I think studies have shown that the immunity that you develop with vaccinations is more durable, more longer lasting and stronger than the immunity associated with previous infection, but others may want to add more there. And just in terms of the questions around the deaths and the causes of death, so I looked at the deaths that have occurred in the hospitals since sort of mid-November, about 400 deaths. Most of them, probably more than half of them had comorbidities. More of them were in older individuals. Most of them had COVID-19 symptoms, but a fair proportion of them were admitted for other reasons and died from other causes. I note particularly some pediatric anecdotal data in terms of all the deaths in Tshwane in children. All of them died from other reasons and not from COVID-19, and the COVID-19 was incidental finding in those deaths. And then also just look quickly at those patients who died and the vaccination status. And we don't have data on vaccination status on all of them, but from what is self-reported in our hospital surveillance, 93% of those who died were either unvaccinated or not fully vaccinated. And then also interesting, 3.5% had been vaccinated more than 5 or 6 months ago. So the picture in terms of the deaths in hospital from the data we do have, which is not complete, is certainly that most of the deaths were in unvaccinated or not fully vaccinated individuals. Thanks so much.
Thanks, colleagues. Minister, any parting shot?
Yeah, I think there were still some questions which Dr. Crisp could take. There was a question about CDC decision, which I'm not aware of, to recommend other vaccines rather than J&J. I think Dr. Jasat has dealt with others. And then vaccination rates in rural areas, Dr. Crisp. And then how long after, I think the one of testing positive we have dealt with before. I think the norm is between 30 and 35 days once you have been free of any symptoms after being infected, that you can come forward to be vaccinated. We can just repeat that between 30 and 35 days when you have symptoms free after being infected with COVID, you can come forward to be vaccinated. I think Dr. Crisp can deal with the rural uptake and also the CDC, the issue, which I'm saying I'm not familiar about CDC not recommending J&J. Dr. Crisp?
Thank you, Minister. So yes, yesterday the CDC did put out a statement about recommending that the country use Pfizer vaccine or Moderna vaccine, in other words, the mRNA vaccines over the Johnson & Johnson vaccine, based on some data that they presented on potential blood clotting after Johnson & Johnson vaccines. I must say, for me and for those I've spoken to, we're very surprised the incidence of blood clotting after vaccination with Johnson & Johnson is minuscule. And it is very strange to us. We will still have to interrogate that data and discuss it with the VMAC, but it's not something that we would recommend here. We don't see any reason why we should do that here in South Africa. As far as the coverage is concerned, we have overall coverage amongst adult population across the country of 44%, but we do publish on the website every day the coverage of the population per province, and it is available per district. And we have said before, and we can say again, the coverage in the rural areas is better than the coverage in the urban areas, which we're very pleased about. At the moment, we have the Western Cape with 52% coverage. We have Free State with 52% coverage, Limpopo with 50%, and Eastern Cape with 49%, and then the other provinces a little bit less than that. But what is also encouraging is that in each province and in each district, we also monitor the coverage in age groups. And I think you heard those figures earlier. 60+ population, we have 66% of the population in that age group across the country vaccinated. And Dr. Klute mentioned that they have in excess of 80%, and I think 85% in the Overberg district of that population. And those are rural areas. So what has been surprising to us from the beginning is how well the uptake has been in the rural areas, and particularly older people in rural areas compared with young urban population, where one would anticipate that there's easier access to vaccinations. So overall, those are the coverage statistics, but they are freely available on the website, and we can make even more detailed information available if required. Thank you, Minister.
I'm not sure if all the questions have been answered, Minister, colleagues. Dr. Chris, are we able?
My apology. I think, yes, we need to conclude. Thank you very much. I don't want to say much, just to say we urge all South Africans again to keep safe. And the best way to do so is to vaccinate over and above keeping safe with other measures. I want to give this opportunity to Deputy Minister Dlomo to round up. Thank you very much, Foster.
Oh, yes, thank you very much, Minister, and to all the panelists who supported the Minister's briefing today. I could just pick up, Minister was saying there's a word or a phrase that he used quite often, working together, that we could do so much as a department, as government, but we need to work together towards this process. Minister was joined by Dr. Rumen, Dr. Justin, actually stressing that the majority of the admissions in our hospitals are of unvaccinated population. So therefore, it really says to us, if we could really go on and do much more vaccination, chances of getting admissions and probably even severe infections in the hospitals are very decreased. So the message is still the same as Minister has been saying over the past. But we're really heartened, Minister, by your wishing the South Africans a safe travel. Because we are aware people are going to be traveling to distant areas, homes, and actually trying to enjoy Christmas, but in the New Year. But you are also emphasizing a responsible situation where all the non-pharmaceutical protocols are adhered to actually avoid spreaders, areas where we can be crowded, going outdoors. But it was very opportune, Minister, for you to invite the two HODs who are actually the HODs of the eastern, of the areas that are having the sea, that is the Western Cape and KwaZulu-Natal. And you are saying if there could be jabs before Joel and the jabs before Jive. And the biggest jaws in both Western Cape and KwaZulu-Natal, of course, including Eastern Cape and Northern Cape, is that our South Africans, holiday makers, will go to those areas mainly to be beach goers. And if maybe, and they will join Dr. Shabalala, hope to join him in the KZN to visit the beaches and see whether I cannot say to people, you're jumping into the sea, have you vaccinated? And we have a pop-up site nearby. And I'm not sure whether the minister would probably consider advising us and really encouraging these provinces with having a lot of sea bed to have sea coast, to have pop-up vaccination sites along the beach side, so that people can actually take the advantage and vaccinate. And that is going to be a majority of the young South Africans. Thank you very much. And I also want to join the minister to wish all our South Africans a happy Christmas and a very responsible Christmas in the new year. Thanks, Minister.
Thanks, Honorable Dr. Susan Dlomo, our Honorable Deputy Minister. Thanks to all the members of the panel, the two HODs from the Western Cape and KZN, members of the media, colleagues. Once more, would like to take this opportunity to wish you Merry Christmas and Happy New Year. But we want to also confirm that as the Department of Health, we're not going to rest, we're going to communicate, we're going to be available and accessible throughout the period. And as I also want to conclude by saying, as the Minister has said, that it's too early to enjoy the Christmas before the 25th. Anything is possible between now and Christmas. So the way we conduct ourselves will determine on how the NWC will decide. Thank you. Until we meet again. Thank you.
Recording stopped.
Thank you, Foster.